10, as you're hearing, summertime means more people outside and a greater chance for injury. So you need to know where to go for care when you get hurt. KJRH reporter Corey Duke found out the emergency room isn't our only option.
Well, Karen, sometimes your injury doesn't require a visit to the ER, but it still requires care. So where do you go and what's the difference? Doctors, weigh in.
Broken bones, burns, dehydration, food poisoning. The list of summertime emergencies is endless. When you're hurt, where should you go?
There are certain symptoms that almost always should be seen in an emergency department. People who are having chest pain, for example, people who are having symptoms of a stroke, like not being able to move one side, having difficulty speaking. If they're having bad pain or they notice severe swelling or they're having trouble using an extremity from an injury, that's something that should be seen pretty quickly.
Urgent care bridges the gap between primary providers and the emergency room.
We do a lot of cuts to fingers, kitchen type accidents, stitching up fingers.
If you're confused about a broken bone,
we do handle basic fractures. We do not handle compound fractures, meaning if you have a bone sticking out of the skin, you really need to go to the emergency room.
Also, use your own discretion when it comes to burns. Both places can handle them, but the more serious, the more likely you need the ER. And while both places can handle minor injuries,
sprains, small lacerations, abrasions, or you see patients with mild medical illnesses, things like a cold or things like seasonal allergies, earaches.
Doctors say those are best suited for urgent care. Bottom line, trust your gut.
If you really think it's an emergency, then you should go to an emergency room. It's better to be safe than sorry.
Yep, as the old saying goes, Karen, always better to be safe than sorry.
Sounds like good advice. Thanks for tracking that down, Corey.